Hello, nursing students, and welcome to today's lecture. My name is Professor Teresa Jackson, and today we are going to discuss a very important concept in nursing. It's infection and protection. In today's lecture, we will discuss the different ways to protect your patients and yourself, as well as the difference between medical and surgical asepsis, and most importantly, how to wash your hands. All right, let's get started. Now, before we get started, this online presentation is only for students in this course. That means you should not share this presentation, any images, PowerPoint slides, transcripts, or any other material from this lecture with anyone outside this course. Failure to follow this rule could be considered academic dishonesty and will be subject to the same consequences. Notes for this lecture are listed on this slide and in the study guide. When studying for the exam, you can use these objectives to help you review the content. If you are able to answer or speak to each of these lecture objectives, you can be assured that you have studied well for the exam. We have a concept-based curriculum. This means that we have a list of major concepts that we use throughout the curriculum and specific exemplars or examples that are used to help you understand each concept. The main concept for this lecture is protection. According to our concept list, which you can find in your fundamental syllabus, protection is the biological defense mechanisms that the body uses to fight environmental and physiological toxins through immune and inflammatory processes. The human body has ways of responding and protecting itself from the threat of infection. In this lecture, we'll mainly discuss infection control and prevention. Nurses play a huge role in preventing infection. This lecture will just be an introduction to this concept. It will continue to be discussed more in depth throughout the program, especially as a co-concept, since many disorders and diseases are caused by or triggered by an infection. Textbook, infection is defined as the invasion of body tissue by microorganisms with the potential to cause illness or disease. Any microorganism can cause an infection depending on a person's risk factors. This is why infection control is an essential part of delivering safe and high-quality nursing care. Patients come in with one problem, you don't want them to develop another. There are two major organizations that set forth guidelines for infection control. These are the World Health Organization, or WHO, and the Centers for Disease Control and Prevention, or CDC. For evidence-based guidelines for treating or preventing infections, we look to the CDC first. On this slide, we have the chain of infection. This image shows that for an infection to occur and spread, we must have 6 links: the agent, the reservoir, the portal of exit, the mode of transmission, the portal of entry, and susceptible host. As nurses, the method of transmission is often the link we try to break to control the spread of infection. Microorganisms do not move themselves. They depend on people, their environment, or objects and equipment to spread. So how does the body protect itself from infection? There are two main types of defenses, nonspecific and specific. Nonspecific defenses, also known as innate immunity, is the defense system that you are born with. These defenses involve barriers that keep harmful materials from entering your body. These barriers form the first line of defense in the immune response. A few examples of these barriers include the skin, normal flora that is in the gut and on the skin, stomach acid, and the mucous membranes and cilia in the nasal passageways, which trap small particles. If a microorganism gets past these barriers, it is attacked and destroyed by other parts of the immune system. Specific defenses are those that we think about when someone says immune system. Specific defenses include active immunity, also known as acquired immunity, and passive immunity. Active immunity develops when the body has been exposed to various antigens and then builds a defense against that specific antigen. An example of active immunity is when you receive a vaccine and then develop antibodies for that infection. Another example of active immunity is when young children go to school or daycare and are sick all the time from being exposed to common community infections for the first time. Once they have had an infection, they develop immunity and are not sick when they are exposed to the same infection again. Passive immunity is due to antibodies that are produced in a body other than your own. Infants have passive immunity because they are born with antibodies that are transferred through the placenta from their mother. Infants can also passively receive antibodies in breast milk. Patients can also receive IV or IM immunoglobulins for certain diseases, which contains antibodies that are formed by another person or animal. Passive immunity provides immediate protection against an antigen, but does not provide long-lasting protection, as it usually wanes over time. Active immunity could be lifelong. When an infectious disease develops, it typically follows a predictable course that involves 4 stages. The first stage is the incubation stage, where the pathogen begins to replicate but does not yet cause symptoms. The second is the prodromal stage, where symptoms begin to appear but are not specific, such as fever and fatigue. The third stage is the illness stage, where the pathogen has maximal impact and manifestations are more pronounced and specific to the infecting organism and site. The fourth and final is the convalescent stage. This is when the infection is contained, the pathogen is eliminated, the affected tissues are repaired, and the person begins to feel better. This is also when patients are at risk for prematurely stopping medications used to treat infections. As nurses, we must educate our patients on the importance of completing treatment as prescribed, even when they're feeling better. There are multiple factors that can put someone at risk for infection, which you can see on this slide. For age, the very young are at risk for infection, since their immune system is considered immature, as they've likely had less exposure to illness and have had fewer vaccines. As for older adults, the normal aging process may increase the risk of infection and delayed healing as changes take place in the skin, respiratory tract, gastrointestinal system, kidneys, and the immune system. Since the normal inflammatory response is delayed in older adults, they often have atypical responses to infection. For example, an elderly patient with a UTI does not typically present with fever and dysuria. Instead, older adults often present with confusion, agitation, incontinence, and falls first. For lower body defenses, this could be patients who are receiving treatment that lowers their ability to fight off infection, like chemotherapy or steroids. Heredity also influences the development of infection in that some people have a genetic susceptibility to certain infections. For example, some individuals are deficient in serum immunoglobulins, which play a significant role in the internal defense mechanism of the body. Also, excessive stress elevates blood cortisol levels, which then decreases anti-inflammatory responses within the body, depletes energy stores, leads to a state of exhaustion, and ultimately lowers the body's ability to defend against infection. Antibiotic resistance happens when germs like bacteria and fungi develop the ability to defeat the drugs designed to kill them. That means the germs are not killed and continue to grow. Infections caused by antibiotic-resistant germs are difficult and sometimes impossible to treat. In most cases, antibiotic-resistant infections require extended hospital stays, additional follow-up doctor visits, and costly and toxic alternatives. Pregnancy is also a risk for infection for both the pregnant patient and the fetus. Changes occur in the immune system, heart, and lungs during pregnancy that make the pregnant patient more prone to severe illnesses for certain infections, such as with influenza. Pregnant patients also need to be carefully monitored for infection and treated for infections, since many diseases can be transmitted to the fetus via the placenta and potentially cause birth defects. Some common examples include CMV, rubella, and toxoplasmosis. As for immunizations, These would increase the body's defenses against infection. As you know, a major infection problem at this time is COVID-19. COVID-19 vaccines are effective at helping protect against severe disease and death from variants of the virus that causes COVID-19 currently circulating. Other infections that are frequently causing disease and outbreaks that are vaccine preventable include measles and pertussis. Cultural beliefs can also affect the spread of disease. Some may have different beliefs of how they got sick or how to prevent illness. There are cultural and religious groups that are against immunizations and various medical treatments. There are also groups that believe in traditional healers or religious healing. It is important to respect others' beliefs as long as it is not interfering with treatment. The first thing you do as a nurse is assess for alternative therapies and how that patient believes they are helping them. You would then work with the patient collaboratively with the healthcare to determine if these practices can be safely continued, especially herbal medications. Incorporating the patient's cultural practices when safe and possible is considered providing patient-centered care. Modifiable risk factors are things that can be changed to decrease your risk developing an infection. These can include things like provide proper hygiene for your patients, provide adequate hydration and nutrition, decrease their stress, and promote sleep and rest, everything Florence Nightingale has been teaching us since 1850. Nurses work collaboratively with a provider or other healthcare professionals when caring for a patient with an infection. The nurse is responsible for each task on this list. We'll go over each of these in the following slides. The most important thing you do and the first thing you do is assess. You will assess and monitor for signs and symptoms of an infection, assess for side effects from medications treating an infection, and assess for improvement and resolution of an infection. Signs and symptoms of a localized infection include localized swelling, redness or erythema, pain or tenderness with palpation and movement, palpable heat in the infected area, and loss of function to a body part affected area, especially if around a joint. Infected open wounds may also exude drainage of various colors. Signs of a systemic infection include fever, increased heart rate and respiratory rate, especially if the fever is high, loss of energy, loss of appetite, and nausea and vomiting. These signs are very nonspecific. Nurses are also responsible for collecting specimens for laboratory testing. These specimens can check to see what infection is present and give us clues as to what may be going on with the patient. A common specimen nurses collect is a culture or a culture with sensitivity. This is where a sample is collected and then is kept in the lab for 24 to 48 hours, and in some cases even longer, to see if anything grows. A culture allows the healthcare team to determine what organism is causing the infection, and the sensitivity allows the healthcare team to know what medications the organism is susceptible or resistant to. A big thing that nurses have to remember to always draw or collect cultures before administering the first dose of an antibiotic. If you collect cultures after an antibiotic has been started, you risk affecting the results. While waiting for results of the culture, the healthcare team will follow evidence-based guidelines to select a medication that will treat the most likely organism causing the infection. This is called empiric treatment. After we have a result with the culture and sensitivity, the provider can adjust the antibiotic based on the organism's susceptibility or resistance. Nurses must also retrieve and monitor lab results. It is important to not only know what each diagnostic test is and what it checks for, but also what abnormal values mean and what needs to be reported to other members of the healthcare team. Which diagnostic tests are ordered depends on the area affected and the signs and symptoms the patient presents with. On this slide, we have an example of a patient whose symptoms include fever, cough, and a sore throat. A few of the lab results are listed. The abnormal values we see so far is that the white blood cell count, or CBCs, are elevated, which likely indicates an infection. You all will learn more about various lab values later in this semester, but the white blood cell count is usually part of a laboratory test called a CBC, or complete blood count. This test not only gives information about the white blood cells, but other parts of the blood as well, such as red blood cells and the hemoglobin levels. White blood cells can be further broken down into different types of white blood cells: neutrophils, eosinophils, basophils, and monocytes. The percentage breakdown of each white blood cell type can point to more of a bacterial infection, viral infection, or allergic reaction. This breakdown is called a differential. So if the healthcare team is going to review the CBC of a patient with an active or suspected infection, they will likely order a CBC with diff. A chest x-ray was also completed for this patient, and the results are suggestive of pneumonia. There are many different tests that can be completed, and nurses are responsible for reviewing the orders, obtaining specimens, and ensuring that the patient receives the ordered test, such as ensuring radiology performs the x-ray and reviewing the results. The nurse is also then responsible for communicating the results to the appropriate healthcare team member, such as the physician, to ensure that the patient is on the appropriate plan of care. Another important role of a nurse is to ensure that they administer medications on time, especially medications like antibiotics. That is what we're going to cover here. This graph is showing you a therapeutic range between these two lines of a drug. So let's say it's an antibiotic, for instance. In between these two lines is the therapeutic range, so that's where we want the blood levels to be for the medication. If that medication level drops below this line or below here, then we're going to increase the risk of resistance for that medication. So we want to make sure the blood level stays higher than that. Now, up here though, if the medication level in the blood gets higher than this line, you're going to see an increase in the risk of side effects. So there's no increased benefit when it comes to treating the infection. Instead, there are increased risk of side effects at that level. We want to make sure the patient stays in the therapeutic range for the medication. That's why it is important to give medications on time, especially medications like antibiotics. Later in the semester, you will learn about nursing diagnoses in the nursing process class. The nursing process is a systematic approach we use to provide patient-centered care. During this process, the nurse first assesses the patient. The nurse then reviews the data from the assessment and determines what problems are present and what the appropriate nursing diagnoses are for the patient. After determining the appropriate nursing diagnosis, the nurse then plans their nursing care based on the diagnosis. They then implement their plan and evaluate how effective their nursing care was. Two common nursing diagnoses for the concept of protection include risk for infection and ineffective protection. Keep these two handy because this will help you in developing nursing care plans in clinicals later in the semester. One life-threatening complication of an infection is sepsis. With sepsis, there is total body infection. The severe infection in the blood, also known as septicemia, results in a massive immune response. In one of your med-surg courses, you will have a 2 to 3 hour lecture focused on sepsis. Now, septic shock occurs when an overwhelming infection leads to life-threatening low blood pressure, which then leads to tissue injury and possibly organ failure. This is why it is so important to prevent infection. And if we can't prevent it, to appropriately treat infection, as it can lead to life-threatening complications. HAIs are healthcare-associated infections. These infections the patient did not have when they were admitted, but instead developed the infection while receiving care. These infections can be caused by poor practices from healthcare workers, but not all HAIs are iatrogenic, nor are all preventable. These infections can develop during a patient's stay in a facility or manifest after discharge. Can you imagine getting treatment for one thing and then ending up with more infections? Not fun. Unfortunately, this is not a rare occurrence. In U.S. hospitals alone, the Centers for Disease Control, CDC, estimates that HAIs account for an estimated 1.7 million infections and 90,000 associated deaths each year. Data from 2014 showed that approximately 1 in 25 U.S. hospital patients is diagnosed with at least one infection related to hospital care alone. Data from 2019 show that approximately 1 in 31 U.S. patients has at least one infection that was associated with their hospital care. So while that number has slightly improved over time, we can do better. As nurses, we provide care that directly impact the frequency of these types of infections. So if we do our job appropriately, we can play a major role in decreasing these infection rates. The most common healthcare-associated infections are pneumonia, surgical site infections, GI illnesses, and UTIs. Many infections have developed antibiotic resistance and become superbugs. Resistance has developed due to inappropriate use of antibiotics. For example, taking antibiotics when you only have a viral cold. Prescribing antibiotics for too long or too short of a time period, and patients stop taking antibiotics when they start feeling better instead of completing their prescribed regimen. Again, resistant infections usually make patients sicker and are harder to treat. Now you may hear different terms be used. Nosocomial infection and healthcare-associated infection can be used interchangeably. However, hospital-acquired infection is a more specific term, as those are infections that occur from care at an acute care hospital and is not an inclusive term for infections from other healthcare facilities like nursing homes, outpatient clinics, and rehab facilities. So, while all hospital-acquired infections are healthcare-associated infections, not all healthcare-associated infections are hospital-acquired infections. Not only are HAIs detrimental to patients, but they can also increase the number of days patients stay in the hospital, reduce the capacity for hospitals to admit other patients needing treatment by occupying available beds, and increase the cost of health care. Also, hospitals do not get reimbursed for the cost of treating an HAI. Studies suggest that implementing existing infection prevention practices can lead up to a 70% reduction in certain HAIs. The financial benefit of using infection prevention practices is estimated to be $25 billion to $31.5 billion in medical cost savings. The most common HAIs are MRSA, methicillin-resistant Staphylococcus aureus, SSI, surgical site infections, VAP, ventilator-associated pneumonia, CAUTI, catheter-associated urinary tract infections, CDI, Clostridium difficile infections, and CLABSI, central line-associated bloodstream infection. When you go to clinical, look at any posters they may have on your unit. Many times they will list the number of days since the last fall or CAUTI on that unit. Every year, hospitals hold skill fairs where nurses are checked on skills related to their specialty. Usually these fairs and checkoffs also include care bundles aimed at preventing HAIs. Be sure to review Table 9.4 on page 602 in your textbook that review causes of healthcare-associated infections. Note the site of infection and the causes of infection. Some of these include improper urinary catheterization techniques, improper dressing change techniques, and improper IV site care. Who is usually responsible for this care? Nurses. You can make a difference. Also note that improper hand hygiene is a cause for all the listed infections. This is a major responsibility for every healthcare team member. Every year, national patient safety goals are published. On this slide, you can see goal number 7, prevent infection, for the year 2024. According to the Centers for Disease Control and Prevention, Each year, millions of people acquire an infection while receiving care, treatment, and services in a healthcare organization. Consequently, healthcare-associated infections, HAIs, are a patient safety issue affecting all types of healthcare organizations. One of the most important ways to address HAIs is by improving the hand hygiene of healthcare staff. Compliance with the World Health Organization, WHO, and/or Centers for Disease Control and Prevention, CDC, hand hygiene guidelines will reduce the transmission of infectious agents by staff to patients, thereby decreasing the incidence of HAIs. To ensure compliance with this national patient safety goal, an organization should assess its compliance with the CDC and/or WHO guidelines through a comprehensive program that provides a hand hygiene policy, fosters a culture of hand hygiene, monitors compliance, and provides feedback. It may seem pretty simple, but hand washing is the #1 best way to prevent the spread of infection. The effectiveness of hand washing is determined by adequate friction, thoroughness, and duration. For hand washing, units will occasionally audit hand washing. They do this by having someone, such as an infection control nurse, stand in the hallway and monitor every employee to see if they do or do not sanitize hands before entering and after leaving the patient's rooms. Many hospitals have some sort of reminder on the doors or on the unit to gel in and gel out, which means to use hand sanitizer anytime they go in or out of the room to improve these rates and practices. As a student on a unit for clinical, you may unknowingly take part in these audits. So for the safety of your patients and to improve the audit rates for the unit you are on, be sure to hand sanitize before you enter the room and when you come out. The CDC lists when you should wash your hands with soap and water or when you can use hand sanitizer. Alcohol-based hand sanitizers are the most effective products for reducing the number of germs on the hands of healthcare providers. It is the preferred method for cleaning your hands in most clinical situations. On this slide, you can see when each method is appropriate during routine patient care. According to the CDC, an alcohol-based hand sanitizer should be used immediately before touching a patient, before performing an aseptic task, such as inserting an indwelling urinary catheter, or handling invasive medical devices. Before moving from work on a soiled body site to a clean body site on the same patient, for instance, if you're going to touch someone's foot, hand sanitize before touching their head. After touching a patient or the patient's immediate environment, after contact with blood, body fluids, or contaminated surfaces, as long as your hands are not visibly soiled from this encounter, and immediately after glove removal. The CDC recommends that you wash your hands with soap and water anytime your hands are visibly soiled, after caring for a person with known or suspected infectious diarrhea, and after known or suspected exposure to spores such as with anthrax and C. diff. While these are the recommendations from the CDC while caring for patients, it is also important to remember when to wash your hands during everyday tasks. You should always wash your hands with soap and water whenever they are visibly dirty, before eating and after using the restroom. Talk about how to perform proper hand hygiene. Now you may be thinking to yourself, I think I already know how to wash my hands by now, and hopefully that's true. But a lot of people actually do this incorrectly, so let's talk about it. Let's start with hand washing first. When you wash your hands, you want to make sure you have access to water, access to soap, and access to something to dry your hands with. When you first start, you're going to want to turn the water on. A lot of places now have automatic water sources, so when you put your hands underneath the sink, it turns on. When you remove them, it turns off. That reduces the risk of infection too, because you're not turning the handles to turn the water on and off. You're going to first get your hands wet, then use soap. There are automatic soap dispensers that administer the proper amount of soap. If they don't, make sure you get enough to get a good lather going. Again, get your hands wet, put some soap on them, and now we're going to lather and really scrub for 20 seconds. What makes hand washing so effective is the friction, the duration, and the thoroughness, making sure you get in between your fingers, on the front and back of your hands, and underneath your fingernails too. You want to do that again for at least 20 seconds. If you can't count to 20 in your head without getting off track or going too fast, you can sing Happy Birthday 2 times, and that will be about 20 seconds. I suggest you sing it in your head though, not out loud. You might weird out your patients if you do. So again, really scrub for 20 seconds. Next, you're going to rinse that off. Everything that you have lifted off of your hands from the lathering of the soap and the friction can then be rinsed clean. Once you're done, you're going to dry your hands. Make sure you use a clean paper towel. Don't dry your hands on your scrubs or on your clothing because then you have recontaminated your hands. So don't do that. Another thing is that once you're done rinsing your hands off, don't flick. A lot of students flick, and think about that. When you're flicking those little droplets off your hands, those droplets are going down into the dirty sink, and they can possibly come back up and get on your clothing or get back on your hands, and then you are contaminating yourself. So try not to flick. So that's how you wash your hands with soap and water. Now, let's talk about using hand sanitizer. With hand sanitizer, you want to make sure you are getting a good amount. Again, at a lot of facilities, when you put your hand underneath the automatic dispenser, it gives you the appropriate amount. If it is a pump that you use, be sure to get enough to fully wet your hands because you want to get enough to sanitize your hands fully. Again, that friction really matters. You're doing the front of your hands, the back of your hands, and in between your fingers. You want to continue to rub your hands until they're dry. That whole process of rubbing it in until it's dry allows it to be effective. Again, big thing, don't rub your hands on your clothing because then you have recontaminated them. That's something that's very common to see because people feel that their hands are still a little wet, so they rub it on their clothing, but now that cleaning was useless. A few more things. It is important that when you're caring for patients and for basic hygiene that you keep your nails short. That is also for comfort too, because you don't want to accidentally scratch your patient. So, in keeping your nails short, if you are looking at your hands like I'm looking at them now, my fingernails do not go above my fingers. That's one trick I use to see if my fingernails are too long. The longer they are, the more microorganisms can harbor underneath them, which is not good. We'll also talk about rings in this presentation as well, but I always wear a flat band that does not have any kind of stones in it, so no additional germs are trapped in the crevices. Those are some things to think about. Now a big one, don't wear false nails. If you wear false nails, it can harbor a lot of bacteria and fungi underneath them. At many places, it's against policy to have false nails, and here at Santa Fe, that's one of our rules too. You cannot have false nails in the lab, simulation, or clinical, and that's why, because it's unsafe. Must apply personal protective equipment or PPE according to the risk of exposure to potentially infectious materials. On this slide, you can see the commonly used PPE items and their general uses. List how and when to use gloves. Note that you change gloves during patient care if you move from a contaminated body site to a clean body site. For instance, if you separate your patient's buttocks to make sure you fully assess the skin for any signs of breakdown, you do not want to keep those same gloves on and then touch the patient's face and adjust their nasal cannula. Think about what you are touching with the gloves on. Just because you have gloves on does not mean they stay clean. Another thing I commonly see nurses do is touch the patient's body with gloves on, then without thinking, touch their mask, their hair, their glasses, their pen, or other objects without first taking the gloves off and performing hand hygiene. Again, remember that just because you have gloves on, it does not mean your hands stay clean. Think about what they have come in contact with. Have you ever seen this meme? Rings that have stones, such as those in these images, can rip gloves during patient care. Would you want this to happen while you're cleaning and dressing a wound? Also, imagine all of the microorganisms that can be trapped in the crevices between the stones. While these rings may be pretty, they can pose a major infection risk. This is why we recommend that if you're going to wear one ring in clinical, that is one that does not have stones. Many students and nurses choose to wear those smooth, rubbery rings instead of their wedding band. Now, where you work, it may be common for you to encounter patient situations that require special isolation precautions. The CDC has guidelines that designate two tiers of precautions. These are standard precautions and transmission-based precautions. Standard precautions are measures that we use for all patients. A few examples of these include proper hand hygiene, using PPE such as gloves if there is a risk coming in contact with any bodily fluids, using cough etiquette, which I've included a document about this in your course called Cover Your Cough, handling laundry, making sure to not hold dirty laundry against your clean scrubs, and disposing sharps and needles in their appropriate puncture-proof containers. Transmission-based precautions are based on the specific infection and how it spreads. We'll go over those next. I have pictures borrowed of the UF Health precaution signs. Hospitals have somewhat similar signs but may use different colors and differ slightly on recommendations. The precaution signs will be hanging on the door, so you know before going into a room the type of PPE needed. The information is referenced from the CDC website. In lab, you will practice putting PPE on, which is also known as donning, and taking it off, also known as doffing. A general rule on most units is no gown or gloves in the hallways. You don't know where they've been, and they may be assumed contaminated. These rules, especially regarding gowns, may differ on a select few units, such as those that exclusively care for patients with COVID-19 infections due to PPE shortages. We will discuss this later in the presentation. So let's start with contact precautions. Contact precautions are used for patients who are known to have or are suspected of having serious illnesses that are easily transmitted by direct patient contact or by contact with items in the patient's environment. A common condition that you may encounter in clinical that require contact precautions is methicillin-resistant Staphylococcus aureus, which may be referred to as MRSA or MRSA. For contact precautions, gowns and gloves are required. A private room is preferred, but patients with the same infection can be cohorted in a semi-private room with permission from infection control. For isolation precautions, it is also recommended that dedicated or disposable equipment is used and kept in the room to minimize the risk of transmitting an infection to others. As for transporting, you want to limit transport and movement of patients outside of the room and only do so if medically necessary. When transport is necessary, cover the infected areas of the patient's body. For the healthcare provider transporting the patient, they will wear PPE in the room, wipe down the handles where they hold the wheelchair or bed used to transfer the patient, remove PPE before leaving the room, and wash their hands. Do not walk down the hallway with gloves or a gown on. The healthcare team member will don clean PPE to handle the patient at the transport location. Droplet precautions. These are used for patients with known or suspected infections with pathogens transmitted by respiratory droplets that are generated when a patient is coughing, sneezing, or talking. A common condition that you may encounter in clinical that require droplet precautions is influenza. For droplet precaution PPE, a surgical mask is required upon entry into the patient's room. If you work in an open area, a mask must be worn if you are within 3 feet of the patient. A private room is preferred, but with permission from infection control, these patients can be cohorted together. In a situation where they are cohorted, draw a curtain between the two patients. If transporting a patient on droplet precautions, the patient must wash their hands and wear a surgical mask outside the room. Again, we always want to limit transport for any patient on an isolation precaution. Precautions are used for patients with known or suspected infections with pathogens transmitted by the airborne route, such as tuberculosis, measles, chickenpox. For airborne precautions, an NIOSH-approved N95, also known as a particulate mask, or a higher level respirator must be worn. An example of a higher level respirator is a CAPR, Controlled Air Purifying Respirator, or PAPR, Powered Air Purifying Respirator. A private room with a negative airflow and the door closed is required. Negative airflow means that the air is sucked into the room when you enter and does not escape out into the hallway. The doors to these rooms need to remain closed when possible. The nurse and other members of the healthcare team must put the mask on before entering the room and take the mask off after leaving the room. Transport again is limited. If the patient needs to be transported, they need to wear a surgical mask and observe cough etiquette. A few of the other precautions and signs you may see in the clinical. The enhanced contact precaution sign is typically for patients with C. diff infections. Please note that you need to use soap and water to wash your hands, and you have to use bleach-based cleaning products to wipe down equipment after caring for a patient on enhanced contact precautions. The compromised host precaution is used to protect patients who have weakened immune systems. These patients are usually neutropenic, meaning they have a low white blood cell count. In these circumstances, you would not want anyone who is sick to enter the room. Typically, fresh flowers, fresh fruit, and fresh vegetables are not allowed due to the risk of microorganisms. HEPA filters are sometimes required for these rooms as well. Due to the pandemic, certain PPE may be required for healthcare workers even if the patients they are caring for do not have known infection that can spread through droplet or airborne routes. This is to minimize the risk to the healthcare worker for contracting COVID in high-risk settings. These pictures show you side by side of the different types of isolation supplies that may be required. Each hospital and state may vary, but they all still follow the minimum requirements that the CDC publishes. In clinical, your instructor will specify the PPE requirements for that institution. The requirements often have to do with the unit type and what supplies are available to the hospital. Some of our area hospitals are using reusable gowns, meaning they get laundered with the patient linen. Some require the nurses to use the higher level 3 isolation gowns compared to the yellow level 1 isolation gown. If you are interested in learning about how gowns are leveled, there is a link in the additional resources area to the FDA article that discusses the different levels. You will not be tested on this information, but do recognize that there are different types of gowns for different types of patient encounters and patient care. Notice the N95 respirator mask. These need to be fit tested for proper sizing. I'm going to discuss asepsis. Asepsis is the absence of disease-causing microorganisms. Using aseptic technique decreases the possibility of transferring microorganisms from one place to another. There are two basic types of asepsis, medical and surgical. Medical asepsis, also called clean technique, reduces the number and transmission of disease-causing microorganisms after they leave the body, but doesn't necessarily eliminate them. It is used to care for patients with infectious diseases, to prevent reinfection of the patient, and to avoid spreading infection from one person to another or throughout the facility. An example of when to use clean technique would be if you were giving a bed bath to a hospitalized patient. Surgical asepsis or sterile technique refers to the practices that keep an area or object free of all microorganisms and is used for procedures involving sterile areas of the body. Items used for sterile technique require sterilization, which can be done through boiling, being placed in an autoclave, using radiation such as UV light, or by using special gas. An example of where surgical asepsis is frequently used is in the operating room. At the bedside, surgical asepsis is used for many bedside procedures such as central line dressing changes and Foley catheter insertions. Any procedure that intentionally perforates the patient's skin should follow surgical asepsis. This includes IV insertions and injections. In many bedside procedures, only parts of the equipment remain sterile, such as the needle for injections. The thing that is critical for you to understand is when something is considered sterile and when it is considered contaminated. Example, a sterile object remains sterile only when touched by another sterile object. If you are wearing sterile gloves and touch a sterile Q-tip that is on a sterile field, everything is still sterile. If a sterile syringe tip touches a nurse's clean scrub top, it is now contaminated. If a sterile field is set up and another nurse walks by and you're not sure if they accidentally brushed up against it or not, that field is now considered contaminated. It is not always obvious when a sterile object becomes contaminated. If you think you may have contaminated an object, go ahead and replace it. While we want to avoid waste as much as possible to reduce cost, the cost to treat a nosocomial infection is much higher than replacing an object that may or may not be sterile. It is also safer for your patient. Any spill is contaminated unless it is on a sterile surface that moisture cannot penetrate. Moisture-proof drapes would have a plastic bottom. If the drape is only made of paper or cloth and becomes wet, that area is now contaminated. Sterile procedures often involve a little extra patient teaching and preparation. During a sterile procedure, you would ask a patient to stay as still as possible, avoid any sudden movements, and avoid talking, coughing, or sneezing over the area. If the patient is not able to follow these directions, they may need to wear a mask or even be sedated. Remember, failure to maintain sterile technique results in healthcare-associated infections. There are 9 principles and practices of surgical asepsis that are listed on page 612 of your textbook. You will practice sterile technique and putting on sterile gloves during your first lab. After watching this lecture, as a short optional learning activity, I would like you to take about 15 minutes to read over the 9 principles and then draw a picture that represents each of the 9 principles. Be creative with these drawings. If you do this activity, please bring your drawings to lab to share with other students and as reminders while you are practicing. You will be tested on these 9 principles and will have to be aware of them in order to perform sterile procedures safely and accurately in lab and in clinical settings. So, in summary, infection can spread easily, especially in the hospital setting. There are precautions that we must take, and there are interventions that we can do to help reduce our patients' risk for infection. As nurses, it is vital that we take these steps to protect our patient from harm. Now, if you guys have any questions, be sure to reach out to me on the discussion board. Also, I'll have a few additional resources down below this video. See you guys later.